In today's video, I want to get more into first impressions, and then, in subsequent videos, we're going to kind of cover different skills from each of these levels. And trust me, there's a whole list I have, so there's going to be more than one video for each of these stages. The first impression skill that I want to talk about first is creating a friendly, warm, and welcoming environment. Right? All the greatest treatment skills in the world aren't going to mean much to the client if they're not feeling welcome in your studio. So that means clutter-free, organized, but not stuffy, in my opinion. You don't particularly want to create a hospital-like clinical environment, which actually has triggering aspects to a lot of people, including myself. But you also don't want to create something that feels unprofessional. All right, so your office should be relatively clean, calm, cool, styled the way you want, but it should feel like it's a place that work is going to happen and not that it's just a place to hang out. You also want to be warm and welcome and inviting, right? I said it in the other video, if you are sitting this way and the client walks in and you just kind of look at them that way and go back to what you're doing, that really isn't very welcoming at all. So as soon as you hear somebody coming in the door, body language matters. So facing the client in a nice open fashion, not closed off from them or like distant or protective, right? Because one of the first goals that you want is that you want the client themselves to relax in your presence and calm down and get into ease. And the way that you do that is that you model it for them. So if you're nervous or self-protective or standoffish or any number of things, that client is going to pick up on that and themselves close off from you, and they're not going to share the things that are going on with them that probably are why they're in pain. So, in the sort of way that I'm facing the camera here, like an open posture, I'm not closing myself off. I'm not like unable to look at them. I can maintain easy eye contact, not intense eye contact, but easy, right? Like this kind of engagement can be a little intense to the client, but and this kind of thing can feel a little bit like you're nervous, right? Just centered in yourself and easygoing. That creates the posture for them to mirror that and feel like, oh, maybe I can relax here. This doesn't feel stuffy. This feels easy and nice and welcoming, right? So body language matters a lot. The other thing I'll talk about is you definitely want to maintain equal power dynamics. Right, so your goal is that you're creating an environment in which you and the client are equal humans dealing with equally frustrating human stuff, but that you are the authority about what might get their pain to feel better. And so I don't want to treat the client, I don't want to have the client sit down and then talk to them from up here, right? Because that creates a weird power dynamic where suddenly like I'm overbearing. Right? If the client's sitting here next to me, I just want to be able to like sit and chat with them, feel very open and comfortable in my own body. If I have a chair with a back, I might sit back like this and relax and just get them, as I relax and as I calm down, hopefully they can pick up on that and they'll start to do that as well. The second skill is create yourself as an authority. So how do we create yourself as an authority while still maintaining a welcoming environment? And the trick is, friendly, professional, not stuffy. And so again, when you're interacting with the client, you don't want to be at different levels. You want to maintain an equal level with them so that creates the two of you as equal humans dealing with something. But then in your language, you want to make sure that you're establishing yourself who's the one in charge of the treatment. Check in with yourself. I'm always teaching therapists about language they use that creates the client as the one who's in charge of the treatment as opposed to you as the authority. An example of that might be asking a client, do you want to start face up or face down, right? It seems simple and it happens in the spa environment all the time, but it actually makes them have to choose their treatment when in fact it's your job to choose the thing that you think will give the best results. And so as you're listening to them and as you're doing intake, you want to check in with them not about how the treatment will go, but about what their symptoms are and what they're dealing with. And you want to maintain the questions about like, so what brought you in today? And they'll tell you, oh, I've had neck pain, I've had back pain, I've had knee pain, etc. How long has that been going on? You know, and they can tell you, well, it started up last week, or, you know, I've been dealing with it for years and ignoring it, and it gets better, it gets worse. And then when you determine, okay, this is the goal, the client really wants their neck pain to feel better, you can say, okay, I hear you. So it sounds like you really want a session today that's going to make your neck feel better. I can do that for you, right? And you can just establish your authority that way. Like, okay, great, you've come to the right place. I think I can help you. You don't want to give a guarantee, right? I know in New York State, it would be unethical for me to make a guarantee about a treatment's results, but I can say, I think I can help you, and I probably can have this feel better. And probably have it feel better today if I think that's the case therapeutically, or potentially it might take a few sessions. By not asking them questions about how they want the treatment to go, you're keeping yourself as the authority over what's going to provide results for them. You can negotiate with them over that, and they can say certain things like, well, for instance, let's say I had a client come in really complaining about neck pain, and I did some body reading and I determined that they were classic, you know, upper chest back, hyperextended back, neck forward. And I really needed to release here in the scalenes and here, right? Hip flexors, back extensors, scalenes, to get this more on top of their pelvis and their head more on top of their pelvis as well. And that, I know, would definitely help their neck pain and relieve it. I might say, we're going to do the whole session today face up, right? And I have a plan for working from the knee up, through the hip flexors, up the center of the body, through the abs, sternal fascia, pecs, opening up the shoulders, and then finally doing posterior and anterior neck work. And I know from experience doing that with, I don't know, thousands of sessions at this point, that is going to very likely provide some very immediate relief for them and get them on the road towards long-term relief. If I ask them if they want to start face up or face down, now suddenly they're in charge of how the treatment goes, right? So to create yourself as the authority, you want to make sure that you're the one coming up with the treatment, presenting it, getting agreement from the client on it, and then doing the treatment. One question I hear all the time, well, would you like a full body session today? Or should we focus on the thing that you want, right? Again, it sounds like a nice question to ask a client, but you're giving them the authority over the treatment when they may not know which of those choices is actually going to provide them better relief for the thing they came in for. So if you have an opinion, you know what, we shouldn't do a full body today, because if your neck is really hurting, I can see that if we focus a little bit more and leave a few things out, I can get this feeling much better. So I'd like to do this. Let's go face up. I'm going to work from the knees up through the hip flexors, up into the abs and the diaphragm psoas, and then I'm going to come up the sternal fascia, out through the pecs, and finish with 15 to 20 minutes of neck work. That's a pretty standard session for me, and I know it's going to provide results for a client in severe neck pain. Again, if I ask them, do you want a full body or not, they might think that they should get a full body, but then not have also have the expectation that their neck can feel better. And essentially you're asking them a question that they don't really have enough information to give a good answer about. In all things, to create yourself as an authority in that first impression stage and in the intake stage, you want to make sure that your questions are gathering information about their symptoms, not about what would solve the symptoms. It's your job to come up with the solution for the symptoms that you think is going to best help them, and hopefully then actually provide those results. Third, first impressions skill I want to talk about is explaining the intake process. What do I mean by that? So a lot of clients, and especially if you work in a spa environment and are trying to transition to more results-based medical massage work, or clients in general might come in from out of town. I work in New York. A lot of people here have the mindset that massage is more medical based, but not everybody around the country has that, or they're used to just the idea that massage is always a full body session, or that we can't help them with pain. Often clients will come in a little bit and just be like, okay, I'll just get on the table now and we'll get going. And actually gaining the skill, and this is a skill of being able to say, hold on, wait a minute, let's chat. Let me find out what's going on with you. You might get a little bit of a reaction from some people who are so used to just wanting to jump on the table, or the clock watchers who are like, I need the full 60 minutes that I paid for, right? And it's like, one of my phrases that I'll say to clients is, look, 55 minutes on the table with a really good 5-minute intake is going to give you way better results than just jumping on the table where I have to hunt and peck for the first 30 minutes just to figure out what's going on with you. All right. And by the time that I've figured it out, I might have a totally different idea of a plan and not have time to really implement it. So with some clients, you might need to say, hey, this is how this is going to go. Nice to meet you. Welcome. What brings you in? And if they're like, oh, let me just jump on the table, or I'm not sure I have time for this, just say, well, we're going to do an intake. It won't be super long, maybe 5 to 8 minutes because you're a new client. And it's an opportunity for me to really find out what's going on with you so that I can really tailor make this session just for you in a way that's really going to give you much better results. It won't be long, but it's so worth it, right? And just kind of having that light but firm attitude about the fact that doing an intake is really important is going to help you get the information you need to design a really good session and have that treatment really land with the client and really provide results. And it does two things. One, it does allow you to create a much better treatment that gets much better results. But two, it sets you up as an authority. And it has that client think of you very differently. When you do a real intake and listen and gather symptoms and then design a treatment for them, it really presents you as a very different kind of experience. And then when you provide those results, because you didn't just do a full body, but actually design something for them, it has them walk away feeling very different about massage, about you as a massage therapist, and about what they can expect from treatments. One other way that you can establish authority with a client is by thinking of yourself as an educator, right? Most clients are not at all as versed as you are as a therapist in knowing what massage therapy can do for them. And many people out there really don't understand that massage is moving away from the spa environment towards a much more medical massage-based, results-based practice in many people's practices. And so they don't really know. Myself, I have a reputation in New York City. The Hospital for Special Surgery orthopedic surgeons often send me their really tough post-surgical recovery shoulder surgery clients, and I've kind of gotten a reputation for that. That isn't something that I built immediately, right? That took a long time of working in New York City. But many clients don't realize that that's even something massage is capable of. And so putting yourself in the position of an educator, whether it's talking about anatomy to the client and how things interrelate, talking about the possibilities of massage, helping them to understand the difference between focused work and a full body session and what the benefits of either one are, really can help you. It helps them learn and think about what you do differently and hopefully let you be the one who designs the treatments. But it also will change their mind about what's possible in a massage. And it will also set you up as an authority so that they, instead of telling you what they should do, defer to your expertise. So that's a little bit about the importance of creating a good first impression and making sure that some of the language that you're using or some of the ways that you're acting, whether it's your body language or the words you're using, aren't detracting from yourself as the authority figure and the one who's designing the treatment. Really think about in your practice, are there things that you're doing that might be either creating a bad first impression, which you definitely want to smooth out, or missing opportunities to create a really welcoming, warm, and authoritative first impression that's going to have the client feel like, yes, I've come to the right place. This person feels like they know what they're doing. It feels like they can help me, and I'm just going to listen to what they have to say instead of trying to run the show. I'd love to hear in the comments below if you've got anything that you can think of right off the bat that you're like, ooh, I didn't realize I was doing that. I really need to change how I'm wording that, or the position of my chair in the office, or the way that I greet a client, whether my body language is closed off. I'd also love to hear if you've got any tips for all of us that I didn't say today, and just hear about how you go about creating a great first impression. If you like this content, please like and subscribe, and you'll hear more of this whole rebooking series, as well as our Advanced Concepts for Massage Therapists playlist, where we talk more about analysis and techniques as opposed to the stuff that happens outside of the treatment. So I hope you like this, and have a great day.